Before we get on to today's video, I did want to quickly make a note that this video is not as positive as others on my channel. In today's video, I talk about the reality of mental health and cancer, and I know that this can be a topic that is triggering and difficult for some, so I would like to make a note to proceed with caution and to just be advised that there are some very difficult topics discussed in today's video. That being said, this is a topic that is very near and dear to my heart and a topic that I truly believe there is not enough talk about. So without further ado, let's get on to today's Chats with Megs. Mental health. I think that mental health is such a loaded topic and there is so much to be said. And honestly, I consider myself to be very lucky that prior to my cancer diagnosis, I can't really say that I ever faced any difficulties with my emotional well-being. However, in saying that, when I was diagnosed with cancer, I definitely felt the effects that it had on my mental health, and I would honestly say just as much as it did on my physical health. And at the beginning of this video, I said that I don't think there's enough talk about it, and I truly do not, which is why I am so blessed to be able to make this video today and to talk about my story in the hopes that others in the same place going through cancer and that feel like they are struggling do get the help that I believe every cancer patient should receive. The other day, I was asked a question along the lines of, if I could redo my journey, what is one thing that I wish I knew? What is one thing that I wish people had told me that I had no idea about? And there were a few things, but the biggest part of it was the impact that cancer would have on my mental well-being. I didn't realize just how much the emotional side effects of it would be prominent and how they would be honestly just as big as the physical side effects. This is exactly why I want to take my experience and the platform that I have been given to share my story and to provide some little tips, maybe some advice that I've gathered along the way to others. Very early on in my cancer journey, I learned that half of the battle with cancer is with what goes on in your head. And that is a saying that I have been preaching from the beginning. Half of the battle is with what goes on in your head. And yes, I was an overall very positive person, and to this day I am. And I really did make an effort to be a positive person, but I can't lie and say that there were not days where I was negative. There were certainly days where these scary and these difficult thoughts would fill my mind and would honestly consume me. Going through something as serious as cancer definitely puts a lot of crazy thoughts in your mind, and even something like death, you see it in a completely different light. You start thinking really deep about topics like what you haven't accomplished yet in your life and what your future will look like, whether you'll ever be able to live the same life ever again, and like just whether you're going to be happy ever again, whether you're going to be okay. And those topics are very hard to process for some, and I think just like with physical side effects from treatments and from cancer, those emotional side effects also come, and sometimes they're unforeseen. You can have your bad days and your good days, and sometimes you can't even predict when you're going to have a bad day, and honestly, pushing those thoughts away can be near impossible on some days. And the thing is that they come out of nowhere. All of those thoughts, all of those feelings, all of those emotions are 100% valid. And if you're watching this, please know that you are not crazy for thinking those things. You are not crazy for playing those scenarios in your mind, because it is normal. You are going through something that is life-altering. But I 100% believe that just like we receive physical treatment for the physical disease that is in us, I think that we should seek out and have help for the emotional side of this, for the emotional side of treatment, because in my opinion, it is just as important. The other day in Canada, it was Bell Let's Talk Day, and that is a day that is focused on bringing awareness and raising funds for mental health. On that day, I also made a post about cancer and mental health, and I posted a question box on my Instagram asking for your questions about cancer and mental health. And in today's video, I do hope to answer a lot of those questions and provide some insight and some tips on cancer and mental health. That being said, I'm going to really try my best not to make this video very long, but there is definitely a lot to be said on this topic. I will also be leaving timestamps in the description box below, so if there are some topics that you don't want to necessarily hear about or just want to skip through, I will leave just where you can go in the video for what specific topic down in the description box below. But without further ado, let's get on to the topic that was probably the most asked about, which is feeling alone and feeling like nobody understands what you're going through. There is definitely this sense of feeling like your friends and your family don't fully understand what you're going through, and they don't understand how you're thinking and what's kind of going through your mind. And this is why certain sayings like, oh, it's just hair, or my so-and-so died from cancer, can be so hard for somebody who's undergoing cancer to hear, because they hit a little bit different once you're in that scenario. And even in my personal experience, my boyfriend, who is my best friend, and he was my caregiver during my entire journey, he was there with me the entire time, he didn't fully understand what I was going through, and he tried his best. He listened, he let me cry, he listened to me explain what was going on, he tried to do little things here and there to make me feel better, but I still couldn't expect that he was going to understand what I was going through, because he was just as new to this cancer world as I was, and he couldn't put himself in my shoes. And I feel blessed that he didn't have to go through that, and that it was me instead of him. But at the same time, I didn't let myself get frustrated, because I couldn't expect him to understand what was going on inside my head. And that is exactly why I think what helped me the most is different forms of support groups, because trust me when I say that there are people out there who understand exactly what you are going through. There really are. And that is why I think that everyone who undergoes cancer treatment should seek help through support groups, through therapy, through talking to a cancer survivor, because those people, they understand you. They understand your journey. They understand the physical side of it. They understand the emotional side of it. And I think that everyone should at least be open to the idea of seeking out support in some form or another. Throughout posting my story on social media, I was so lucky to meet so many people and to be in groups where I felt like I was heard, where I felt like people truly could resonate with what I was going through and help me in a different way, in a sense that somebody who doesn't know what it's like to go through cancer could help me. And they became my friends. A lot of them to this day I consider really good friends, and we support each other, we understand each other. And I think that was such a big part of my healing and just of me being able to go through it as positively as I could. And I am going to link a few resources down in the description box below. Of course, I don't know them all, but I have been exposed to quite a lot in the last 2 years that I've been in this, so I'm going to leave a bunch of resources down below. But I truly can't express that there are people out there who understand you. So please do not go through this alone. Please do not feel like you're in this by yourself, because that is not the case. There are certainly people out there. And in saying that, I also did want to talk about another topic, which is therapy. I think that we need to normalize therapy, not even just with regard to cancer, but just in general. But if there was one thing that I wish I had done differently, it was to work with a therapist from the very beginning. I, looking back, 100% can see how a therapist would have benefited me, and how I would have been able to better learn how to handle and how to work with my emotions and the thoughts that were creeping up inside of my head. And so my recommendation to anybody who feels like they're struggling is look into a therapist. I think that just being open-minded and giving it a try, there is absolutely no harm in that. I know oftentimes hospitals have their own therapists, or you can seek out private therapists. So please, just if you are in that bubble, please know that there are people out there. There are support groups out there for you. You just need to go out and get them. Another topic that was often asked about was how I coped with it and how I was able to keep up that positive attitude, how I was able to face the emotional kind of roller coaster that I was going through. And if you're not new to my channel, if you've watched my videos, you'll know that it was 100% my mindset and my positive attitude. I really had to make that conscious effort to see the little beauties in the day, to see the glass half full, to really see the upside of things, and to take my story and my pain and my struggle and put it into good. And that really takes a lot of learning about yourself and learning about what you need to do to be able to put yourself in that positive headspace. I really had to focus on my triggers. What triggered me to have those negative thoughts? What triggered me to, be in that like rabbit hole, and then really notice when I was going down that rabbit hole of negative thoughts, what did I have to do to bring myself out of it? And in that scenario, my first instinct was always to occupy my mind. I knew that when my mind was focused on something else, when I was thinking or working on something, I didn't have time to be stuck in my head, because I just have this really bad tendency of being stuck in my head. And it's like I can't get myself out of my own head once I start thinking. And so right away when I would get those thoughts or those feelings, I would just do something to keep myself occupied. And when I say that YouTube was a huge part of that, I truly mean it. I mean, anybody who has ever made, like filmed, edited, planned out videos before, they know that it is a lot of work. There's a lot of effort that needs to be put into it, and a lot of learning. And me, who had zero experience with it beforehand, that is also a huge reason why I just dove into it so much, because it required me to learn and to work on it. And on days where I needed something to focus on, that is what I focused on. Another really big trigger for me was negativity, and it was in a bunch of different forms, whether that be negative conversations, whether that be people that were negative, whether that just be like negative vibes around me. I knew that when I was put in a situation that was negative, I would just vibe off of that and I would become negative. And so I definitely had to create a lot of boundaries where just I would not let that negativity in, and I would try to keep my space and things around me as positive as possible. And those boundaries have honestly served me so well until this day. I still have those boundaries in place, and it just makes me a happier person overall, and it does so much for my mental well-being. Boundaries are hard to create, but I think that once we do the work to put them in place, they are definitely a huge help. In saying that, also self-care, you'll know that I am a huge advocate for self-care. Self-care really helped me with my physical well-being, with my emotional well-being. I truly just see the value in taking a minute to take care of yourself. And the last thing that truly helped me cope with mental well-being while I was undergoing cancer treatment was to have something to look forward to make myself excited for something that was to come, and just to plan for my future, to get excited. And as cheesy as this sounds, I always looked forward to planning my next YouTube video, filming it, editing it. Like I loved it, and I would get so excited planning out the next YouTube video. And that for me was what kept me going, and planning out the next Instagram post, kind of what pictures I wanted to take, what I wanted to talk about. That got me going. And then once I was kind of on the other side of treatment, I was looking into like products to grow my hair, growing my hair back, new recipes, ways to get back into fitness, how to like go back to work and transition back into a normal life. And I think that just kept me so motivated and so excited that I was just for my future. I was just so excited for my future. I was so excited to just like keep going with my life. And that is why till this day, I am a huge advocate for vision boards and for anything that has to do with motivation and for the future, because I just think that there is so much mental well-being in just having something to work for, and it's truly helped me so much. And on the topic of future, another question that I was asked was, am I afraid for my future? Am I more cautious now for my future? And I can't lie and say that there weren't days where I questioned what my future would look like. There were days where I wondered, would I ever lead a normal life? Or like, what does this mean? What does cancer at 22 mean for my future? Like, am I gonna have a future? And I think that those are valid thoughts to think, but those thoughts and all of that really fueled my passion for my healthy lifestyle. For me, it was knowing that I was doing everything in my power to ensure a healthy lifestyle and a healthy future for myself. That is what kept me going. So this is why I really took the approach of eating cleaner, eating healthier, like learning about my body, learning what my body needs, physical well-being, slowing down my fast-paced life, reducing stress. I really took it upon myself, and I think that knowing that I'm doing everything that I can for myself and for my future just makes me feel so much more comforted, because I am in control. And so No, I don't really stress about the future. I know that, like I said, I'm doing everything that I can and I'm trying my best. And I'm just constantly giving myself things to look forward to and things to be excited for. And I can genuinely say I'm very, very excited for the future. And I think that this is a perfect transition into the next topic, which was how I'm doing now. How is my mental health now, following cancer and following everything that I obviously went through. And I can say that it is really good. In my day-to-day life, I don't think about cancer, which is crazy for me to say because there was definitely a point when I finished cancer treatment that I couldn't imagine my life where a day would go by where relapse wasn't on my mind. I felt like once I finished treatment, relapse was just a constant scare, and every little thing would make me be scared of whether I made the right choice and whether I was okay or whether, something was happening inside of me that I wasn't aware of. And for a long time, I definitely struggled with that. But as time went on, those thoughts, they went away. And although I still talk about cancer, it feels like it's something that happened to me, but that it's so far away almost. And we are almost 2 years past it. And yeah, it feels like it's something that's far away. It's something that happened to me and that it's over with and it's in the past. And I truly feel so lucky to be able to say that I don't think about it and that it doesn't really affect me anymore. And so if you're in that space where you're worried about, what does my life look like after this? With time, once you get back into a routine, once you get back into life, and then there's so much more to life than cancer, you begin to realize that it's something in your past. And even when it comes to things like pain, like when I would feel some sort of a pain, my first thought would be, oh my goodness, I'm relapsing. But now it's not. Like I don't even consider it to be a potential thing of a relapse. And that's not to say that I'm obviously not careful and I'm not looking out for signs and symptoms, because I am. I have to be, I am. But it's just, I can't believe that I can say that, like, I'll get a pain and I don't associate it with cancer, and that's such an amazing feeling. So please know that if that is the case for you, you're worried, with time, it does go away. Okay, this next topic is one that there was so many questions about, and it's a topic that I've been meaning to cover for a long time, but it's a very loaded and heavy topic, and that is the topic of survivor's guilt. And oh my goodness. Okay, and survivor's guilt, for those who don't know, is basically the guilt that a cancer survivor feels because they survived, meanwhile others didn't. And putting my journey on social media, being super public about what I was going through, I've met a ton of people, and I am so blessed to have met so many people. And a lot of those people were others in similar situations as me, going through cancer treatment. And it breaks my heart to say that a number of those people didn't make it. And I think survivor's guilt is something that is so conflicting, because you want to be happy that you're okay, you want to be excited for your future, you want to move on, but then you're faced with the loss, and oftentimes it's people that you talk to, people you got close to, people that definitely understood you and you felt so connected to. And you begin to wonder, why me but not them? Why do I get to keep going? Why do I get to keep living? Meanwhile, they didn't get that opportunity. And it's such a, I think, conflicting feeling. And it's such a valid feeling. And I've definitely gone through my own, battles with processing it, especially like people that I grew close to it. And it's crazy because it's like you never met them in person, but you felt so connected to them and close to them, because you were going through the same thing. And it's definitely not something that's easy to process, and it takes time. And I think that it is completely fair to feel like you lost someone close to you and feel like you need to grieve their loss. And so for me, I think I really took that loss as my reasoning for why I keep going, my reasoning for why I keep advocating for this, for why I keep talking about cancer in young adults, because for them, I want to keep on pushing, and I want to keep on advocating for people to take their health seriously, for people to go see a doctor when they need to, for people to really just realize that life is beautiful, life is precious, but we're not invincible, and to take your health seriously. And I think as long as I keep pushing for that, and I keep sharing my story and sharing my journey and giving a voice to those who can't have a voice, I, in my own way, am honoring those who are not here with us today. And the last topic that I will be covering in today's video is a question that I think is very important. So thank you to the lovely lady who did ask this question. And it is, what can nurses and medical staff do to better support cancer patients emotionally? In my experience, a nurse can make all the difference during treatment. I feel like cancer patients see their nurses a lot more than they see their doctors. Like, yes, their doctors run the show, but nurses are the ones that keep the show moving, that keep the show flowing. And they're the ones that check up on you. They're the ones that administer your treatment. They're the ones that usually go over any sort of like medication, signs and symptoms with you. And they're the ones that you spend your day with when you go to get your treatments done. And so I think that nurses really have that advantage of that level of closeness with a cancer patient. I know that I had a lot of trust in my nurses, and I trusted them to give me my treatment. I trusted them to help me manage my side effects. And I think that a positive and a happy nurse can just completely, like, it would completely change my day when I would just walk in there and I knew that after my chemo days, I'm gonna feel so sick for a week, but just a positive and happy nurse who would just smile and would just talk to me would completely change my day around. And I would just be happy there, sitting there receiving my drugs, because like, it was just kind of like pleasant to be there. And I did have this one nurse and she was just amazing. And she would always talk to me and just be so kind and smiling. And even on days where she wasn't the nurse that was assigned to me for the day, she would come to us and say hi to Alex and I, and just, she would talk to me like I was just a regular person she was having a conversation with. She would never talk to me like I was a patient. And I wish I remembered her name, but if by any crazy chance you are watching this, you know exactly who you are. Thank you, because you honestly made a world of difference to me on days that were really hard days to go through. And so I think that just, you know, like a nice smiling light conversation and just positive kind of vibes around can truly make or break a cancer patient's experience when they're going through chemo. And I know that not every, you know, patient is as happy or sees things the same way. And I also kind of think that, as I said before, nurses have that extra kind of level of closeness that doctors may not. And I think that in the same way that nurses ask, you know, how have you been managing your side effects? How have you been feeling? Like, how have you been taking your medication? I think that they should also be asking, how are you doing emotionally? How has it been, you know, not being able to work, not being able to go to school? How are you coping with it? And how are you, you know, how are you doing? And I think that a cancer patient having that trust in that nurse would be honest about it. And even if it's just a conversation, even if it's just allowing them to get it off their chest and to just talk about it, that already can help so much. And I think that if nurses have any resources or know of things, because they're obviously kind of in that world, I think that is also worth sharing. So I definitely think that nurses are amazing, and to all the oncology nurses and medical staff out there, thank you so much for what you do, because your kindness, your positivity, your patience with us, with our fears, with our worries, completely makes a world of a difference. Whew, wow. I feel so fortunate that I have been able to have this platform and I've been able to share my story, and that people, you know, share to help others and to spread awareness about cancer in young adults. And I'm truly blessed to have been able to make this video about cancer and mental health. As I said at the beginning, this is a topic that is very near and dear to my heart. This is also a topic that I don't think is talked about enough. And I think that there needs to be more talking about how your mental health, your emotional well-being could be affected while you're undergoing treatment. And I think that, again, half of the battle is with what goes on in your head. So to anyone watching this, I definitely, please sign up for those support groups. Please talk to people, because there are people out there who understand you. And to everyone who made it this far in my video, thank you so much. It is because of you that I'm able to continue doing this, and it's because of your likes and your subscribes and your support and your views that I'm able to keep on going and to keep on spreading this message. So thank you to all of you for supporting me this far. But that is all for today's video, and I'm going to leave the links to any support groups down below, and then the timestamps obviously will be down below if you want to go back to any portion of the video. But thank you so much for watching. Know yourself, know your body, and until next time.